Hi, welcome to Eduvis Academy's YouTube channel. Eduvis Academy is providing classes for nurses who are preparing for licensing exams like Prometric, Haad and DHA. It's an online application program. It includes theory classes, exam-based theory classes, which is a 35 hours online class. In addition to that, we have questions, question discussions, mock test and exam mode practice test. So basically one of the most important feature of our app is that you can watch the classes at your own convenient time. So with all these facilities, we can assure you that you can clear your exams easily. Okay, so let's start our question discussion session. And before starting that, one more thing we would like to remember you. If you like this video, please like, share and subscribe. Okay, so let's start the question discussion. Okay, let's see the next question. You are assisting an MD with the removal of chest tube. What activity may the MD have the patient perform while the chest tube is being removed? So, while removing chest tube, what activity should you give to the patient to perform? Options are A. Valsalva maneuver, B. Leopold maneuver, C. Suprapubic pressure and D. Mac-Roberts maneuver. So, if you see the options Mac-Roberts maneuver and suprapubic pressure, these are the two methods used in shoulder dystocia. Shoulder dystocia means difficulty to deliver the shoulder once the head is delivered. So, to manage the delivery of the shoulder, we apply these two methods, which is applying suprapubic pressure, and the next method is Mac-Roberts maneuver. So, these two answers are wrong. Coming to the third option, Leopold maneuver, which is also a palpation method used in pregnancy, which is used to palpate the uterus to determine the position and the descent and presentation of the baby. So, option B is also wrong. What we ask the patient to perform while removing the chest tube is to do Valsalva maneuver. Valsalva maneuver means you should ask the patient to hold the breath and then forcefully exhale while the chest tube is removed. So, first you ask the patient to pinch your nose and then mouth and hold your breath, and while removing the chest tube, ask the patient to breathe out forcefully. Okay. So, answer is option A, Valsalva maneuver. One of the important point regarding Valsalva maneuver is that this is contraindicated in patients with heart failure because it decreases the heart rate. So, Valsalva maneuver is contraindicated in patients with heart failure. Okay. So, here the question is about which activity should be performed, which comes into the answer Valsalva maneuver. Next question, a nurse receives a telephone call from the admission office of the hospital and is told that a patient with streptococcal meningitis will be admitted to the medical unit. The nurse is planning to apply infection control measures for the patient. Which type of isolation precaution the nurse must observe? So, here options are A. Droplet precautions, B. Contact precautions, C. Airborne precautions and D. Standard precautions. So, here question is about patient with streptococcal meningitis and what isolation precaution should be done. So, you should understand that meningitis, especially streptococcal meningitis, mostly all the meningitis are transmitted through droplet. So, the precautions which you should take is droplet precautions. Okay. So, the important point here is that meningitis is transmitted through droplet, and so the precaution which you should take is droplet precautions. Next question, a 9-month-old child is diagnosed with bronchiolitis due to respiratory syncytial virus or RSV and is admitted to the pediatric hospital. The nurse should initiate which of the following isolation precautions? So, here again the question is about isolation precaution, and what is the problem? The child is having bronchiolitis due to RSV or respiratory syncytial virus. So, respiratory syncytial virus causes infection mainly in children. It mainly affects the upper respiratory tract. This disorder is also known as laryngotracheobronchitis or tracheolaryngobronchitis. The important point regarding this topic is that its transmission is neither by airborne or droplet. The transmission is by contact. One of the questions which has come regarding the RSV is that what is the health education that you should give to the mother of a child with bronchiolitis or RSV virus? So, the answer is about maintaining hand hygiene, which is the most important precaution for contact infections. So, here if you see the options, contact, airborne, standard and droplet, and since it is RSV infection, the precaution you should take is regarding contact precautions. Next question, a woman patient is admitted for abdominal pain. She complains generalized pain, nausea, vomiting and constipation. There is rebound tenderness and abdominal rigidity. Her pain is localized on the right side. BP 130/68, heart rate 92, respiratory rate is 18 and temperature is 38.6. What should the nurse suspect? So, whenever the questions comes regarding this scenario, what should the nurse suspect means what is the diagnosis of the patient. So, how should we diagnose the patient? We should assess the signs and symptoms which the patient is showing. So, here generalized pain which is localized on her right side, okay, and second important thing is rebound tenderness. So, rebound tenderness is a characteristic feature of appendicitis. Rebound tenderness means when you palpate, the patient doesn't feel pain, but while withdrawing, patient feel tenderness and pain at the right lower quadrant. So, rebound tenderness and abdominal rigidity. Abdominal rigidity indicates the complication of appendicitis. Complication of appendicitis is rupture and peritonitis. The ruptured content will cause infection in the peritoneum, and when peritonitis occurs, the characteristic feature which the patient shows, patient have is abdominal rigidity or abdominal guarding. Hard and rigid abdomen is called as abdominal guarding, which indicates peritonitis. So, here what should the nurse suspect? There are 4 options: intestinal obstruction, influenza, appendicitis and D, pyloric stenosis. So, as I said, rebound tenderness is seen in condition called appendicitis. And second clue is that pain is localized on the right side. Okay. A 26-year-old patient in the gynecological ward complained of pain and swelling in her episiotomy stitches on her second postnatal day. On examination, there is localized swelling, redness, foul smell and pussy discharge were identified at the stitches site after examination. The nurse checked vital signs: BP 116/28, heart rate 132, respiratory rate 28 and temperature is 39.8. Which of the following should the nurse do prior to the patient examination by the gynecologist? So, before gynecologist comes, what should the nurse do? So, first see the question, what are the problems of the patient? Main problem patient is having is pain and swelling in her episiotomy, and on assessment we saw redness, foul smell and pussy discharge. All these indicate infection of the episiotomy wound, and therefore there is swelling and pussy discharge. And there is one more thing on vital signs. If you see, patient is having tachycardia and temperature is 39.8, which indicates fever. So, all these symptoms indicate patient is having infection in the episiotomy wound. So, before gynecologist comes for examination, most important thing the nurse should do is that before assessment, let us see what are the options. A, arrange dressing instrument. B, maintain patient privacy. C, arrange stitch removal kit. D, collect detailed history. So, out of these 4 options, before doing any procedure, first thing which is important for the nurse to do is maintaining proper privacy for the patient. See here, the assessment is going to be done on episiotomy wound. So, first important thing is maintain privacy and then start other procedures. So, answer is option B, maintain proper patient privacy. Maintain patient privacy. Next question, 38 weeks pregnant woman complains that she has been craving to eat non-food items. What is the term that describes this pregnant mother's condition? So, here the condition has been explained and the question is about the term which describes this condition. So, what is the problem? She has been craving to eat non-food substances. So, there are 4 options: A, pica, B, bulimia, C, anorexia, D, binge eating. So binge eating means eating large amount of food, which is commonly seen in an eating disorder which is known as bulimia nervosa. Okay, so B and D are removed and left is anorexia. Anorexia means loss of appetite, and there is another condition in psychiatry which is known as anorexia nervosa, which is also an eating disorder in which the patient will not take food in the fear of weight gain. Despite no matter whatever severe weight loss she or he has, there will be anxiety in the patient's mind that his or her weight will be increased, and therefore they will not take food, which results in severe GI and electrolyte balance and even cause death in some patients. So these three are related to B, C and D are related to eating disorders, but these are the definitions. Bulimia means eating large amount of food, anorexia means taking no food. So the definition is craving to eat non-food items is known as pica. Craving for non-food substance is called as pica. Next question. During physical assessment of a male infant genitalia, the nurse found that one of the testes are enlarged. Which of the following could be the reason for swollen testes? Option A, cordy, B, cryptorchidism, C, hydrocele and D, hypospadiasis. So swelling of the testis is related to which condition? That is the question. So option A, cordy. Cordy means abnormal bending or abnormal sharp curvature of the penis. Cryptorchidism is also known as undescended testis, in which the testis will fail to descend into the scrotal sac. Hypospadiasis means urethral opening is beneath the which is below the normal area. Okay, so that is known as hypospadiasis. The question is about the swelling of testis. Swelling of the testis is associated with hydrocele. Hydrocele means there will be a fluid filled sac which is scrotum due to inflammation of the testis. So swelling of the testis is associated with the condition known as hydrocele. All these options, all these conditions are birth defects, but here the question is about swollen testis, and so the answer is hydrocele. Next question. A 4-month-old infant returned immediately from room post cleft lip repair. Which of the following nursing intervention should be considered? So here the child has returned after cleft lip repair. So what is the priority post-op care? That is the question. A, apply elbow restraint. B, apply suction when needed. C, measure temperature. D, put infant in prone position. So coming to option D, put infant in prone position. So what we have to see is that the surgery is cleft lip. So you cannot place the baby in prone position because it will cause the surgical site to touch in the bed and will cause bleeding. So prone position is mainly given in child with cleft palate surgery. So postoperative position for cleft palate is prone position, not for cleft lip. Second, measure temperature. Apply suction when needed. Applying suction will also causes complications because it will the first thing is that it might touch the surgical site, and applying pressure to the surgical site will lead to complications. So main focus of the child with a cleft lip or cleft palate is that you should prevent the unwanted touching of the surgical site. The baby might touch the surgical site because it's not in their control, and they will have a tendency also to touch the surgical site. So most important thing to prevent the unwanted touching is to apply elbow restraints. Or there is another device known as Logan bow, which is a metallic clip. You will apply it around the surgical site, so that whenever the hand comes in touch, it will touch only that metal clip, which is known as Logan bow. So here option is apply elbow restraints. And another thing which you should do while applying elbow restraint is that you should release restraints every 2 hours. Why? To prevent injury or redness at the site. Okay. So for a child with post cleft lip repair, the most one of the important intervention is to apply elbow restraints to prevent unwanted touching. Next question, 24 hours after delivery, nurse noted that the newborn has failed to pass meconium. This indicates which of the following condition? So, the problem is newborn failed to pass meconium. Options are A. GERD, B. pyloric stenosis, C. failure to thrive, D. Hirschsprung's disease. So, GERD means gastroesophageal reflux, in which the child will have vomiting due to weakening of the lower esophageal muscles, which causes heartburns. Second is pyloric stenosis, which causes narrowing of pylorus, and the connection between the stomach and duodenum will be closed, resulting in projectile vomiting. Okay. C is failure to thrive. Failure to thrive means due to severe malnutrition, it is difficult for the child to survive. This feature, failure to pass meconium, is seen in condition called Hirschsprung disease or aganglionic megacolon. Aganglionic megacolon means absence of ganglionic cells in the lower part of large intestine, mainly in sigmoid colon and rectum, resulting in absence of nerves which helps in normal peristalsis. So, because of absence of peristalsis, what happens is that stool from the upper segment came to this area, affected area, and will be accumulated there, which results in the distension of colon, which is known as megacolon. So, the features, most important clinical features in Hirschsprung disease is, initial sign of Hirschsprung disease is failure to pass meconium. It is known as meconium ileus. And second important feature we have discussed in the earlier question discussion session. Second important feature is that ribbon like stools. Okay. So, failure to pass meconium is seen in Hirschsprung's disease.